Hello, welcome to Healthy Eyes Hub. In our previous video, we talked about the risk factors for glaucoma and how glaucoma occurs. Today's video will focus on how glaucoma is diagnosed. Please like, share, comment, and subscribe to this channel if you haven't already. Also press the notification button to receive more updates when new learning materials are uploaded. Let's begin. There are several tests undertaken in order to conclude that someone has glaucoma. The workup for glaucoma aims to identify characteristic optic nerve changes and visual field defects, exclusion of other causes, for instance multiple sclerosis or MS, and intraocular pressure, usually above 21 millimeters of mercury, but the latter is not required for glaucoma diagnosis. There are different tests that can be carried out by an eye care provider to diagnose and monitor glaucoma. First is the eye pressure test. An eye pressure test, also termed tonometry, uses an instrument called a tonometer to measure the pressure inside your eye. Your eye care provider will put a small amount of pain-killing or numbing medication and fluorescein dye into the front of your eye. They will then shine a torch into your eye and gently touch the surface of it with the tonometer. Alternatively, different instruments with either a tiny probe or puff of air can be used to check your eye pressure. The instrument that uses the puff of air does not touch the eye. The second test is central corneal thickness. This test is important to determine whether an eye pressure check is actually a true value. This is because people with thin corneas appear to have lower pressures than it actually is, while the vice versa is true for those with thick corneas. The third test is gonioscopy. Gonioscopy is an examination to look at the angle formed where the inner part of the cornea and the iris meet. This is where the aqueous fluid drains out of your eye. A gonioscopy test can help to determine whether the angle or trabecular meshwork is open or closed, which can affect how fluid drains out of your eye. It will tell your eye care provider what type of glaucoma you have. The fourth test is visual fields assessment. A visual field test, sometimes referred to as perimetry, checks for missing areas of vision or blind spots. You may be shown a sequence of light spots and asked to press a button to indicate which ones you can see. Some dots will appear at the edges of your vision, that is your peripheral vision, which is often the first area to be affected by glaucoma. If you cannot see the light spots in the periphery, it may mean glaucoma has damaged your vision. Last but not least, optic nerve assessment. The optic nerve, which connects your eye to your brain, can become damaged in glaucoma. So an assessment is carried out to see if it's healthy or otherwise. For this optic nerve assessment, eye drops will be used to enlarge your pupils. Your eyes are then examined using a slit lamp, that is a microscope with a bright light, or optical coherence tomography, simply called OCT. It is a type of scan where special rays of light are used to scan the back of your eye and produce an image of it. The eye drops used to widen your pupils could temporarily affect your ability to drive, so you will need to make arrangements for getting home after your appointments. Remember that a good comprehensive history taking is key in diagnosing glaucoma. Being diagnosed with glaucoma is not a hopeless situation. In this present 21st century, there is a lot of help available to preserve your remaining vision. The essential point though is early detection and management. In our next video, we will talk about what happens next after one is diagnosed with glaucoma. Remember to like, share, comment, and subscribe to this channel. Thank you.